Welcome to Value-Based Care Insights, brought to you by Lumina Health Partners, a national healthcare consulting firm focused on improving the strategic, financial, and operational performance of provider organizations. On this program, we will explore trends and share valuable insights on how health systems and medical groups can optimize their performance to meet the demands of this increasingly complex healthcare environment and shift to transform the delivery of care. Value-Based Care Insights is hosted by Daniel Marino, Managing Partner of Lumina Health Partners. Daniel has been in the industry for over 3 decades and specializes in shaping strategic initiatives for organizations in areas such as population health, clinical integration, physician alignment, information technology, and data analytics. For additional insights, visit luminahp.com and sign up for our newsletter. Dan, over to you.
Welcome to Value-Based Care Insights. I'm your host, Daniel Marino. There's been a lot of press recently and really over the last year about the challenges with Medicare Advantage. Many health systems across the country are evaluating their role within Medicare Advantage. And it certainly has created some challenges for these organizations as they think about how much they want to position themselves within Medicare Advantage, taking care of their patients within their community. And on top of that, it's no secret, CMS is really pushing the industry towards Medicare Advantage and really moving patients out of straight Medicare and either to MA contracts or to ACOs. So like I said, it creates this challenge, but also does create some opportunity. And as well as there's been many organizations across the country who've been really challenged with Medicare Advantage. Some of them have chosen not to participate in Medicare Advantage contracts. There's been other provider organizations who've been able to align well with certain payers and have done reasonably well within the Medicare Advantage space. Well, I'm really excited today to have a guest who's been on the show before, Sarah Hartley. Sarah is a system director for a large health system here in Chicago. She leads the ambulatory risk adjustment and clinical documentation integrity work for the organization. She's been responsible for HIM departments, CDI programs, both inpatient and outpatient, and is really responsible for the alignment of practice operations with not only Medicare Advantage contracts, but ACOs and other value-based contracts as well. A wealth of knowledge and experience. Sarah, welcome to the program.
Thank you. I'm so glad to be here.
So, Sarah, as I mentioned, it's no secret many organizations have really struggled with Medicare Advantage. I think from a couple of perspectives, many of them have seen a lot of the administrative challenges associated with the level of reimbursement for Medicare or Medicare Advantage. There's challenges with getting pre-certifications, there's increased denials, there's administrative costs that have been associated with managing the relationship. What are some of the challenges that you've experienced or that you've seen as you've worked through a lot of your MA contracts and your MA relationships with your payers?
I would say probably our biggest challenge is taking on that administrative burden and getting the physician buy-in in that, because there is a lot of administrative burden back from MA plans in terms of data, the amount of data that we receive, the requirements to meet all of the measures. And so the challenge is, how do we make it easy enough for our physicians to address it with their patients and meet the needs of our payers as well?
Yeah, I can see that. And the reimbursement, when you look at the economics, the reimbursement is at Medicare rates, right? In some cases, may even be below Medicare rates for associated with the MA contracts. But the key to it is, as the performance of the plan improves, as the star ratings of the plans improve, then there's incentives that are associated with that, right? So if you're looking at a 4.5 star rated plan, that incentive on top of the Medicare reimbursement is higher than a 3.5. But it does not take the place, I think, of the administrative services, right, that are required. Are you seeing, when you talk to some of your colleagues, are you seeing an increase in a lot of, say, denials related to some of these pre-certs and other activities that you normally wouldn't get if you were in straight Medicare?
Yes, we see a lot of denials and pre-certs, the increased scrutiny with our DME providers, increased scrutiny with the annual wellness visits. There are quite a bit of denials coming through that we just don't know how to manage yet,
Yeah.
especially in the new space.
Well, absolutely, absolutely. And I think that's what a lot of folks are looking at. The other area that you touched on a little bit, it's the performance outcomes. So the other challenge that we have with Medicare Advantage is not only are we faced with potentially higher denials and reduced reimbursement, but there's also performance outcomes that we have to hit as an organization. How have you been able to overcome that challenge?
I think the key is to have a holistic approach. We have to get out of working in silos in healthcare. The goal is to keep our patients out of the hospital, and we have to work with our hospital providers and our outpatient providers to look at the patient as a whole and treat them as a whole. And so getting that data from our payers can really help us manage that. So getting the subject matter experts at the table that can speak to each piece of that movement for the patient through the system.
Has getting the data from the payers, I mean, I know you have your own data, right? And you're looking at your billing data, you're looking at your quality data. I'm sure, you're pretty sophisticated. So you're looking at a lot of the reports to identify how you can kind of close the gaps and so forth. But the data from the payer is really important. Have you been able to create that alignment around sharing of that data with your payers?
Not yet. We are building a platform to do so. The challenge is that our internal data just looks at our claims.
Right.
A patient can go anywhere. And so when you look at them as a whole patient, their RAF score, their quality measures under that contract, they can go anywhere, and the patient needs to be managed appropriately. So as we align and we can see the data align, if we get it into one platform, then we can see the pictures, the patient's whole story, regardless of where they go. So ingesting that data is the path that we're on right now to paint that picture of the whole story.
Yeah, so it's really the claims data, right? Because as you said, when patients go anywhere, and you have your billing data, so you know what's occurring within your organization, but you don't necessarily know what if they, you're in Chicago, so you may have a lot of folks that go down to Florida, right? The snowbirds or to Arizona.
Correct.
So if you're responsible for them, you need to get that claims data and really begin to understand what's occurring as they do get care elsewhere.
Yeah, absolutely.
How about the vastness of the data? I mean, one of my clients I was talking to, we were helping with some modeling of a Medicare Advantage contract, and the amount of data that they had both internally in the organization, and then they did get sample data from the payer. Pulling that together was enormous. Is the vastness of the data typically an issue?
It's a major issue, especially if you think about all of the plans that you contract with. Everybody has a different way of looking at the data. They have different terms for their data. They have different processes, different platforms. And then when you get into managing all of the patients or all of the beneficiaries in those plans, it can be enormous and it's overwhelming. So the biggest question, the most important question to me is, what are we going to do with it? Is it actionable data?
Yeah, I can see that. And, as well, you want to manage the patients the same way across the entire practice.
Correct.
And there are certain requirements from different plans. Some measures and capturing of some data within the care model is important to this plan, and there may be some other elements that we have to capture for other plans. How are you managing across that with the physicians? Because I would think it would be either one, really confusing, or you don't want your physicians to cherry pick, right? Only do some patients and some on another. How do you manage through that?
Those are big discussions that we're actually having right now. Are we payer agnostic?
Yeah.
Or do we drive based on the plan, right? And so we're looking at how do we help our providers in Epic by highlighting the patient with the plan attached, I don't know that they're going to know what that means in the intricacies to the contract with the plan, but it will help the administrative staff at least.
Yeah.
So we really look at payer agnostic as the approach right now, and then manage the intricacies on the back end for our providers.
I absolutely think that's the way to go. Because at the end of the day, and this is the conversation that I often have, at the end of the day, we're entering into all of these contracts with payers, whether they're fee for service or fee for value. But if you truly want to make a change, you have to manage the population. It's population health.
That's right.
Yeah. And in some cases, it's really how you form follows function, right? So as you start to think about all the different indicators, it's almost like, well, you have to do all this on everything, right? Or at least begin to negotiate what are the primary set of data elements that we need to capture or outcomes we need to drive to and so forth, and incorporate those in all of your contracts.
Correct. And I think that's an important piece to think about too. Who do you have at the table as you negotiate the contract? You need to have the subject matter experts at the table as well.
Yeah. Do you incorporate like your physicians or lead physicians in those conversations?
We do have physician senior leadership that has conversations with our contracting department. I've had conversations. Our clinically integrated network is very aligned with our contracting department as well, so that we know very well kind of what our contracts are and how we move forward.
Well, it sounds like from the work that you've been doing, you really have to take a proactive approach on working through this with the payers. And I think this is, in some cases, what makes it difficult for some of the providers. You know, in my mind, and I'll let you respond to this, I think it comes down to four things. One, understanding currently where you are and where you need to go with your Medicare Advantage contract. But there's a couple other key pieces that, as you were talking, sort of resonating with me. I think one is making sure you focus on the data to drive the change. I think the other is understanding the knowledge, right? Doing that continued education with your providers. But the last one is probably the culture, because it is a change in culture as you're moving from not just fee for service to fee for value, but straight Medicare to Medicare Advantage. Thoughts on those?
It is a massive culture shift for the entire healthcare industry, and we have to help our providers come along with that. It is that, you know, Medicare says by 2030, they want all patients on a Medicare Advantage plan. So this is not going away. And as we see these big health systems come together, you're challenged with merging the cultures of the multiple health systems and then changing the culture of the way that our providers have practiced and coded and billed for the entirety of their career. And so it's a huge shift for our providers. It's a huge shift for our patients and the staff that are part of the work.
If you're just tuning in, I am Daniel Marino, and you're listening to Value-Based Care Insights. I'm here talking to Sarah Hartley, and we're discussing how providers can guide success through a Medicare Advantage contract. So building off of that, Sarah, one question that's come to mind as you're going through this, you know, we're talking about what the providers need to do. What do you feel like the payers need to do to reposition themselves to improve that relationship with the providers?
They have to support us. I think there is, and when I say support, I mean we need education. There is not a lot of subject matter experts out there in the ambulatory value-based care space, right? We started in the inpatient world. So how do our payers, who are the experts in this, help the providers get to the next level? They have all kinds of educational resources for us, but they're recorded webinars and things like that. So when you have a dedicated team from your payer, the support from them, the meetings, understanding the metrics, asking, you know, how they can get us the data. Is there an Epic Payer platform or some other electronic health record support that they can provide us the data to interface for our providers? But really the education, understanding the data, and any interfaces that we can get to see the patient's picture as a whole is really important. And then partnering with the person whose job it is on the provider side to do care management or care coordination or HCCs with the partner on the payer side, so that you're speaking the same language.
Well, and the partnering, the collaboration is such an important factor on driving the success. If you think about it, we all have the same goal, right? We want to provide the highest level of quality to our patients at the lowest possible cost, right? It sort of aligns around the triple aim. So if that's the goal, what I feel like is a breakdown between the payer and the provider, each of those entities, if you will, have a different approach to get there, right? And again, if you're not aligned and you're not taking the same road, if you're not collaborating on the best path to achieve that goal, then you're going to continue to have challenges. And I think that's what you're pointing out. Perfect example is care management that's being provided in the provider community and case management that's being provided by the payer.
Correct. And we are challenged with that because there's diagnoses that come out of that care management by the payer that are not validated or ever seen on the provider side. So the challenge then becomes with matching up the data, making sure that it's accurate. You, again, not speaking the same language. We're not even reading from the same playbook at that point.
Right.
So really making sure that we have the right data and the same data on our patients is going to be really important.
Why don't you think payers maybe collaborate more or as much as they should with the providers? Do you feel like maybe the financial incentives are not aligned, or maybe they're just struggling with the same thing the providers are struggling with, such as the vastness of the data and understanding where to start? Any thoughts?
So I think it's twofold. I think one, you're right, the vastness of the data. There's just so much data. But from my experience with all of our payer partners, they want to work with us. They are eager to work with us. The challenge on our end is that we are so overwhelmed with the amount of data and the amount of ask coming to us on the administrative side that it's a challenge for us to do so.
Right.
So they are very eager because I think they have incentives on their end as well, right? So it benefits them, but I think it takes the health system, the provider wanting to align and understanding the importance of that. I have asked that all of the risk adjustment HCC work be broken out of the overall quality meeting, because I'll end up getting 5 minutes of my meeting. So really having focused time to dive deep into the data with your payer partner is important. And you have to look at it from your perspective and then as a whole picture.
That's such a great point, right? So you're really aligning on where you want to go. And, the payer, being that they have a level of information and data that you as a provider don't have, but you have a level of information, certainly the clinical data, that the payer doesn't have. I think to be able to come together to really deliver a more comprehensive view for that patient through that level of collaboration, that's what's going to drive the results.
Absolutely right. And that is what is going to keep our patients healthy and out of the hospital.
Yeah. So when you think about recommendations, when you think about how organizations maybe can take that misaligned relationship, if you will, and steer it the right direction, is there some key recommendations that you'd like to put forth maybe to some of the folks on the call that are in the payer community or even in the provider space?
First, I would say align your subject matter experts. You have to have the right knowledge to move the needle and have the conversation. And then make sure you have the necessary data. And for the provider side, it's back to basics. Why is this important? How does it impact them? What is it going to do for their patients? And really make it important for them and make sure that they understand it. That's going to help start to drive the change. And when you find your champions, they can certainly help partner with the providers or the payers, as well, to help us kind of move that needle forward. But I would say foundational work in laying the groundwork, making sure the knowledge is there, the subject matter experts are there, we have the culture, the necessary data, and the tool alignment to move forward.
So I would think that you would have your regular operational meetings where you would think about working through with the payer on how to align. The payer's probably there and have that level of representation. but in some cases, it probably only takes you so far, right? In other words, you come out of that, it's like, okay, that's a really good meeting, but then where do you take it? How much of a higher level governance type of a structure is important? So you mentioned senior leaders of the health of the health system, but I also feel like it's important to have senior leadership of the payers come together as well too, because if you're going to really drive the culture change, it needs to come from the top.
Absolutely. And what is our goal? Set a 3-year plan goal or a year plan goal at the higher level, at the senior leadership level, and we're aligned with the payer and the provider on our goals going forward. Are we going to meet 5 stars this year? Is it going to be 4.5? What are our goals? And then meet regularly, whether it's quarterly, every other month with the senior leadership, but align from top to bottom is really going to help move that needle forward as well.
Yeah, and I'll tell you, many times, at least with a lot of the clients that we have, that higher level governance is really missing. I really feel like that could be a big opportunity for change. And I think a lot of times organizations, both the payers and the providers, they're still negotiating from the framework of fee for service, not the framework for fee for value, and certainly not collaborating as much as they should.
Right. I think it's important for the payers to really understand the challenges of the provider. Because what we're challenged with is the more we put on our providers, the more they dig their heels in. They can't possibly do another annual wellness visit. Their schedule is full. Well, that's on us to figure out how to open the doors for them. But we have to have alignment across the system because everywhere kind of trickles down.
Yeah.
So, yep. And when I say executive senior leadership, I mean inpatient, outpatient, acute care, ambulatory. It is a full circle, holistic picture of the patient, and that's how we should be strategizing as well.
Do you think, given your experiences with working with the payers, you're very proactive, and I give you a lot of credit for that. I think that's what's driven a lot of the change. Maybe few number of organizations don't have an individual like you who's really pushing that, and I think that's a big credit to you. Do you think it would be important to create almost like a third party to come in? Maybe somebody who's agnostic in managing the data, or somebody who's agnostic in managing care management, right, between the provider and the payer. Do you think that's a role that could potentially work? Or do you feel like maybe, hey, we have the resources between the payer and the provider, we just need to agree to work together and collaborate more?
I would say it depends on how large the health system is. From my perspective, a 9-hospital health system, we are absolutely too large to manage all of that data internally. So we do partner with a vendor that helps bring all of that data together. So not just our claims data, our affiliate claims data, and our internal EHR data, as well as our affiliate EHR data. So we are able to see the picture of the patient, all of our patients that are on our rosters, from our affiliates and our employed providers, from the claim perspective and the medical record perspective. So we're doing what our longitudinal record cannot do in a separate tool, which is going to give us that full picture of the patient.
Yeah. Well, and I think having a third party in there that can help, one, bring it all together. They have the expertise, and you're not going to recreate that internally, but they provide, I would think, an unbiased view of both your health system or a health system and the payer, which would help you move a little bit quicker. So I can see a lot of value with that.
Yeah.
For any of our listeners who, as I mentioned, come from the provider space or come from the payer space, any pieces of advice, if you were to give a quick 30-second recommendation to how they can work better towards getting themselves more aligned around their Medicare Advantage contracts or their performance of their patients, any thoughts come to mind? Where should they start?
Start with understanding where you are in your contracts, where you're going with the contracts, aligning your quality measures, looking at your MLR, your star ratings, making sure that you have the right data and the right people in line to make those decisions to start driving that culture change.
Yeah, and I think what's clear coming out of our conversation today is you have to be proactive. You can't sit back and let the payers drive it. You, as a health system, you really do have to drive that and make sure that you're putting forth that culture of collaboration. I think that's key.
Yeah. At the end of the day, we are in control of the data.
Yeah, great point. Great point. Well, Sarah, I want to thank you for coming on today. This is great, and I know it's an important topic that many of our listeners can relate to, and I think as we continue to see a shift into value-based care, we have to do a better job of creating success around Medicare Advantage. So I commend you and your team for the work that you're doing. Thanks again for coming on today.
Thanks for having me.
And I want to thank everyone for listening and for you all tuning into Value-Based Care Insights. Until the next insight, I am Daniel Marino, bringing you 30 minutes of value to your day. Take care.
Are you at a crossroad with value-based care? Do you need to chart a future strategy or improve your organizational performance? Visit us at luminahp.com to learn more about our consulting services and leadership development programs. Also, you can sign up for our newsletter on our website and follow us on Twitter and LinkedIn. For more information about value-based care insights, visit the programs page on healthcareradionow.com or luminahp.com. Join the conversation using our hashtag VBC Insights. We are Lumina Health Partners. Thank you for joining us today. Until the next value-based care insight, stay well.